Welcome to Medically Speaking. My guest today is Dr. Jeff Visco, a colorectal surgeon and the site director of surgery at Millard Fillmore Suburban Hospital. Doc, thanks for joining us today.
Absolutely, Mike. Nice to be here.
So I want to talk about COVID-19 and some of the damage from a collateral damage standpoint that is done to patient care. Obviously, there's a lot of focus on people who have COVID-19, but there's been another impact for those who are trying to seek care from a surgical side. So if we can, let's start with COVID-19. It hits spring of 2020 and really runs the entire year. You as a surgeon, you're faced with some tough choices, tough news of taking care of patients. Walk us through what was going on during those two moratoriums when it came to elective surgeries.
Sure. Kaleida had to pause and kind of halt elective surgeries at that time. This was a time that had a lot more challenges than we were dealing with now. At the time, we were looking at data from Europe, from New York City. We didn't know exactly what was going on. There were some very big concerns that we've solved as of now. One of the big concerns was the amount of personal protective or equipment or PPE that you hear about. That was limited at that time. We had to preserve that. So that was one of the reasons that we kind of paused surgeries. We also had to take care of our community. We didn't know what the surgery was going to do in terms of bed needs. Whenever a surgery happens, unless it's outpatient surgery, patients generally need to be hospitalized. In an effort to meet the needs of our community and the people that we care for in the greater Western New York area, we had to kind of pause doing elective surgeries in order to take care of those that might need beds for COVID symptoms. This was a time before we had vaccines. We didn't know what impact this would have on our employees, nurses, doctors, staff. So that was kind of a emergency situation where we had to kind of pause everything that we could do to preserve the resources that we potentially would need. There were very few good things that happened during COVID, but one of the things that really happened that I've observed is kind of a coming together of our administrative and physician leaders. There was a lot of thought put into, many hours put into decisions that were according to what prioritized surgeries. Purely elective surgeries obviously were paused, but things that may affect someone in the future, things like cancers, intractable pain, those kind of things still needed to be done. And balancing that with providing resources for our community for potential COVID surges was a difficult thing for everyone. It was difficult for us in the surgical executive committee, and we kind of took the lead from the Department of Health recommendations and kind of interpreted them to best serve our community and provide great care for our community in the Western New York area.
Yeah, absolutely. And so that surgical executive and that leadership group really, helped weather the storm in 2020. But, you come into 2021 and, there's another pause because another surge. How did you feel about getting through that? And how did you help communicate some of that stuff to your patients who were worried that they're going to get caught up or their surgery is going to be postponed or is going to be an impact on them?
It's been difficult, to be quite honest with you. The challenges with each wave have been a little bit different. All of them have been equally challenging for patients, their care, the uncertainty that they have in terms of canceling their surgeries and whatnot. This current wave, I think we've met a lot of the previous challenges. PPE has been solved. There's now vaccines. The people that are coming in are all COVID tested prior to their surgeries. So there's a lot of concerns that from the first and second wave that we haven't had to deal with. But again, the basic challenge this wave has been bed capacity. This time, despite the fact that Omicron may be less deadly, as they say, it's much more virulent. It is spread a lot easier, and it's been spread around our community, and still does require bed capacity for us. In terms of communicating to our patients, that's basically been, again, through kind of the network that the administration, the physician leaders, our offices have developed. In face of challenges, a lot of times beautiful things come out of it. This is one of them. I think the communication has improved. Physicians are starting to help each other. The administration and physicians have really bonded together to meet this challenge, which is really kind of inspiring.
You talked about bed capacity and knowing, what cases should or shouldn't be done. So for the viewers out there, maybe explain the difference of someone who is getting their knee replaced. Some may be able to have that surgery done, some may not. But tell the viewers why. What's the difference of someone who there's two different people are going to have knee surgery. One gets postponed versus the other. What are reasons for that?
The basic tenet that we're living under right now is cancer, life, limb, and emergency. And those are the cases that are being prioritized. So it's a difficult thing to prioritize people, but with the communication we've developed, people that have intractable pain that can't live another day without a knee replacement will take priority over someone where it's an elective thing that could be done in the future. It all has to do with potential morbidity that may exist. And that's kind of what the tier system that the Department of Health kind of outlined helps us to prioritize. There's 1A, 1B, those are purely elective things. And then you get to the 2s and 3s where they need to be done or something bad could happen. This has been a real big pause in healthcare. 3 years can make a big difference. It's going on the third year now. You can't really ignore some of these things that may cause somebody to have something bad happen in the future. From my own perspective, things like colonoscopies, delaying them 3 years potentially really affects somebody's life in the future. A small polyp may turn to a cancer. Things of that nature really need to be addressed. This has been a fluid kind of evaluation. The way that we're dealing with it has been changing day by day, to be quite honest with you. When people are faced with adversity, things like this sometimes happen where you come out and kind of better on the other end. That's my hope for the end of COVID, which hopefully is in the near future.
Yeah, absolutely. So as you said, looking toward the end of COVID, what's your message for the viewers out there from a sense of taking care of the community, taking care of patients? Because it seems like you guys have put together a pretty good rhythm and you have, in the face of some significant challenges, confidence now that you can take care of the community in the midst of these, challenging times.
100% accurate. If you look at the challenges we had, ventilators, PPE, we've met all those with this kind of cooperation between physicians, administration, the patients that we deal with. I think we're going to beat the virus. Each wave we've faced new challenges. Each time we've come up with appropriate answers that are prudent, patient oriented, and basically deliver the best care to the people that we care for. Be patient. Hopefully this is the last wave or one of the last. Each time we get a little stronger. Each time we have met the real challenges. We've really come tremendous strides in a few years. That's really something that's kind of beautiful about humanity.
Yeah, absolutely. Great message indeed. Dr. Jeff Visco is a surgeon and one of the physician leaders helping West New York battle through COVID-19. Doc, thanks for joining us today.
Thanks very much. Appreciate it.